Hello and welcome to the GE Centricity Electronic Health Record. Today we're going to be reviewing massage therapy orders and some key concepts to remember. The objectives for this training are to go through creating and submitting an order to the billing department, and some key concepts that we'll cover are signing and routing options, viewing previous massage documents, and go over the differences between care alerts and the preferences section of the initial evaluations. First, we're going to cover creating and submitting an order to the billing department. Then I will walk you through actually creating one in the system. Please remember that every patient will have an order placed for the service provided. You place the order in the procedure section of the MT summary form. Bottom left box of the MT documentation guide highlights this step. You must click the yellow Go to Orders button in this form. Once you click this, it'll take you to a module where you can select the type of service provided for that appointment. Interns will select student massage and providers will select therapeutic massage. Then you must sync the appointment to a diagnosis code. In order for billing department to receive our orders, we have put in a self-pay diagnosis code for services that are not submitted under insurance. This example would be used for many of our student massage patients. For those who are seeing auto or work comp claims, you sync the proper diagnosis code referred by the physician. Once you are done, interns will click OK, and providers will actually sign these documents, or orders. Some key concepts to remember for orders. The order is placed, it is the exact same as the fee slip used when you check in. This is created in the documents to match the clinic date of service for the billing departments to process. Interns cannot sign orders or notes. And diagnosis codes, also known as problems, are placed on a chart and stay as active until changed to inactive. Please note that the order policy is that supervisors and billable providers have 24 hours to sign the order from the date of service. I am now logged into Mickey Mouse's chart as a training user. I have completed my note and all of the information is automatically translated into the text version. Under the MT summary form, you will see the Go to Orders module. Once you click this, it pops up as an option for you to select services. Under massage therapy, we have student massage 60 and 90 minutes, and therapeutic massage ranges from 15 minutes to an hour and a half. For a student massage to select 60 minutes, you will note that it automatically loads into the section here. The patient is self-pay is already as the potential diagnosis code. You can click the Add to Diagnosis to the orders here, or you can drag and drop into the box. This pop-up is just telling me that there's a maximum diagnosis of 12 codes linked. You can check this box so it doesn't pop up again. From here you will see that as a training user here, I do not have the right to sign the order. So as a student, I would just click OK. I am now logged in as if I was a provider. I'm going to open the note that is ready to be signed. From here you can click the text translation to review the quality of the note, confirm the intern signature at the bottom, and open the order module. From here you'll see the student has already placed the order of student massage and synced it to self-pay. From here you would just click Sign. Because I am not authorized as a bill provider under this training user, I will just click Cancel. In addition to signing the order, I would also sign the note by clicking End. Please note that if you open your document and you review the quality of the note and you're ready to sign it, if there is an order placed under this document, you will also be signing the order. So it is very important for you to open the order module in addition to signing the note. Therefore, you can alleviate any mistakes made when the students log in and place the orders for you. So for this example, I will hit End and sign. In the event that you are a provider working with an auto or work comp claim, typically it's an initial evaluation and their chart summary is blank. There's no problems entered, allergies, directives, alerts, or medications. It is okay for you to go ahead and order your service under the note and not enter the problem in the chart summary. From here you would select your service under massage therapy as therapeutic massage for those that are billable providers. The potential diagnosis box will be blank. It is here that you can enter examples that you will be referred for, such as headaches or whiplash or other diagnosis codes that were given to you in the referral. You can click OK and it is added to the potential diagnosis. This is also where you would add patient is self-pay if it is not there already for future self-pay appointments, but you would only sync the ones that are applied to this service. So if this is an auto work comp claim, this is not going to be adding patient as self-pay. We would just add the one that was used for the service. From here you can click sign and continue documenting your note. In addition to creating orders, other key concepts include signing and routing options. It is highly suggested as an intern to route the document to your supervisor or billable provider only when the document is completed and ready to be signed. The bottom right-hand corner of the documentation guide also highlights these steps. When you are not done, you click End, select yourself to route back to your chart desktop, and click Hold. When you are done, there's two different options. For interns, make sure to put your intern signature on the bottom of the note, and you can also see the intern signature job aid for directions. You click End, but here you select the billable provider to route to and click Hold. For providers, before signing, review the quality of the note, confirm the intern's signature, sign the order, and sign the document. To highlight these steps, I will show you again. The End is up in the right-hand corner, and these are the routing options that pop up. If you are not done, it is suggested to check yourself in this box and click Hold to route it back to yourself. If you are done with your note, click End, and this allows the provider to show up that you imported in the beginning of your note. If you note that it automatically preloads the provider to route to, so you would check yourself if you are not done, or check the provider when you are done. This will route the note to the provider by clicking Hold. Now that we've reviewed what an intern does when they're not done and when they are done, lastly I'm going to review what the provider reviews before signing the note. They will review the quality of the note, confirm the intern's signature, sign the order, and sign the document. In cases where the providers do not have interns, you will obviously be not having an intern signature, but you will place the order and sign the order, and you will complete the document and sign the document within 72 business hours of the patient visit. I am now logged in as a provider and ready to sign this document. Once I click Edit, it will open the document, and I'll go to the text translation to review the content of this note. Go to the bottom to confirm the intern signature. Open the order module and confirm there is an order placed. In the cases of providers that do not have students, this is where you would place the order and sign the order. You can also place the order by going to the order button here. But you will see it already is signed and the status is complete. Once you are comfortable with the content of this document and you have signed the order, you can end and sign the document. Another key concept for us to review is viewing previous massage documents. Previous massage or previous documents in general that are coming through as attachments are either A, converted from our previous EHR system backchart, or paper documents scanned into the system with doc management through the front desk. Anything that comes through as an attachment is noted here. This is an attachment icon. It looks kind of like a paper clip. Documents created in Centricity can be expanded and viewed more clearly by clicking the document icon. Documents that are uploaded or scanned, you can expand them by clicking the attach icon. I'm now in Mickey Mouse's chart, and I'm going to show you this right here is where the attachment icon appears. You'll see some communication down here, but in order to actually review this document in its entirety, you'd have to click the attach button over in the right hand corner here. This brings up the PDF version and it will allow for printing. There are many other options in Mickey Mouse's chart as it is a test and dummy patient. For documents that do not have the paperclip or attachment, it just has a paper here. You can view it by looking at the expanded version down here, but you sometimes often have to scroll, so it is nice to click on the paper icon, and this allows the printable version to be expanded more clearly in an extra web browser. If there are many documents on the patient's chart and it is difficult to search for a previous massage document prior to seeing the patient, take the following steps to accurately search for the proper document. Open the patient's chart, click the registration link on the left-hand side of the screen. This will open a module the front desk uses for booking the appointments. The only tab needed on the top of the registration screen are appointments. Click this tab to open the appointments. This will show all the appointments scheduled, canceled, or completed as checked out, or even entered in error. Search the appointments for previous massage status of checked out and take note of the appointment date. Close out of the registration application by clicking Cancel. Click the Documents link back on the patient's chart. Search for the document with the appointment date of service noted, and open the document by clicking the attached icon button in the lower right hand section of the documents. Then the PDF will open the original document. In Mickey Mouse's chart here, you will see back in June of 2015, a conversion from backchart came over as an initial evaluation. We aren't sure if this initial evaluation was a chiropractic visit, massage therapy, or acupuncture. And when you click the attach button, it will expand here and you confirm its content. But if there are many converted documents and they all say similar things, it is easier to select registration on the left-hand side here, appointments, and confirm all of their appointments. And typically you'll go to one of the very first times to see an actual time and date. Take note of this date, close out or cancel, and look back at that date on the documents section. This will allow for the attachment to be found more quickly. The last key concept to remember are care alerts and preferences. Care alerts are found in the patient's chart summary and are for viewing of all users, providers, and interns. This area is used to communicate important information about the patient, and it can also be used by the front desk. In some cases, this section can be edited or deleted. Therefore, for a permanent placement to the patient's chart, use the form loaded into the initial evaluation under Experiences and Preference. You may also add it to the care alerts and flags. Please note that our previous system back chart, there were a section called Patients Notes, and the front desk has added those patients' notes to our Centricity system under the Care Alert section. Sometimes if you change things in the clinical list, it will create a document called Chart Maintenance. Clinical list changes are grouped by problems, medications, allergies, directives, observations, and orders. So if you click on anything in the chart summary, not necessarily care alerts, but other things, just be mindful that the chart maintenance documents are started and they do need to be signed by the provider. The other area that we can add preferences are in the initial evaluation. This section is found in Experiences and Preferences form. It's automatically loaded when you start an initial evaluation, and for viewing this section, you will open the document and look for the Subjective Preferences for Section header. In this case, this patient wants to start face down, prefers pressure to be deep, and not to address the face in any future session. If that information to you is very important and you would like to add it to the care alerts, you may also do so if applicable. Just for review, I am in a dummy patient under Minnie Mouse, and I selected the Experiences and Preferences form. These are the automatic preloaded options for you to select, so in cases where the provider or the patient expresses they do not want certain things or they do prefer certain things, you can indicate it here. If there is none, click none, but in cases such as no heat or only to be starting prone or can't lay in supine or avoid my feet and hands, you can enter that information here. But in some cases this patient is not new and you would like to add information, you can also add it into the Care Alerts section here. This plus sign allows you to open the Alerts and Flags module. As a care alert, it will add the patient's name and you can route it to somebody. In this case, I'll just put no heat, and then you can send that and save it to their chart. It will automatically load and it doesn't have to be routed to anybody. There's also another place up here on the banner called New Alert and Flag. It opens the same module. It will automatically preload the patient's name that you are under for their chart. And I will click cancel here, but when you want to expand this, if there's more than one, you can either expand it or collapse it, or you can click Alerts and Flags here. And if it has not been reviewed, then it will say 1. But by clicking Chart Summary, it just collapses the same information. This concludes our orders and key concepts, and you may contact the help desk at extension 357, or their email is listed here if you have any questions or issues that you may occur. Thank you very much for your time, and have a wonderful day.